Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be your host for today's show. We're here with Dr. Eugene Goldberg of Wellness Associates, a chiropractic clinic down here in Pittsburgh, Pennsylvania. And on today's show, we're going to cover a very interesting topic, and that is acupuncture. Now, if you're like me, you probably have this preconceived notion of what acupuncture really is. You see somebody laying there with needles, sticking out all over the place. I don't know about you, I'm not really that big of a fan. I've never had that type of acupuncture done because really I'm not a big fan of having tons of needles stuck all over me. That's just me personally. Researching for this show today, we found out that in chiropractic and here at Wellness Associates, you do a method called actually non-invasive acupuncture.
That's correct, Jerry.
Tell me a little bit about what non-invasive acupuncture is.
Basically, what it is, it's a blunt needle with a spring on it. Like, for instance, this is right here, non-invasive acupuncture, so this is large intestine 4. So I'm actually giving myself a treatment right now. Does that feel good?
Definitely feels better than sticking a needle in there.
That's true. Now, there's 144 different acupuncture points on your body, so you can do the invasive with the needle, or you can do the non-invasive, which is a blunt needle with a spring on it, which is the same effect. You're getting the same beneficial effect from it.
So more than likely, there's some people watching this show right now that maybe haven't thought of acupuncture for a treatment of the problem that they're having.
Correct.
And maybe they were concerned about and not a fan of the needle. So now, again, as we talk about on this show often, there are alternative methods of treatment to help benefit everybody. Now, when we look at acupuncture, I don't understand all the theories behind it. What can you tell us about really the theory behind acupuncture?
Basically, acupuncture works with 144 different acupuncture in your body. They're like circuit breaker points, okay? Acupuncture, they say that if you have a pain, it's due to a blockage. Let's say you're driving on McKnight Road and there's a truck stalled in front of you. You're not the problem. The problem is the truck stalled in front of you because you can't drive on McKnight Road. So what we do is we remove the truck, remove the interference, remove the blockage. What this does, it helps your nervous system, it helps your circulation, it helps the energy flow in the body. People don't realize that your body is 100% energy, okay? So if there's a blockage in energy, you're going to have a symptom, you're going to have a pain. You can take a Tylenol, or you want to remove the interference, which acupuncture does. See, to me, chiropractic and acupuncture, they work perfectly together because they both balance the body and they both remove interference. So once you balance the body, remove the interference, 9 times out of 10, your symptom goes away.
Now, when you take a look at, and maybe some people right now are thinking, okay, I've got these different problems. I've got a knee problem, I've got a shoulder problem. Or how does acupuncture fit into that as far as part of their treatment protocol?
Part of the treatment problem, you ask, why do you have the pain? Okay, if you have a pain, it's due to like a pinched nerve, okay? So what we do is, through chiropractic, remove the pinched nerve, and the acupuncture, we also help the nervous system remove the blockage, okay? Like, for instance, somebody has sciatica. That's a good question, Jerry. There's a point right behind the knee. It's called B54, works with the bladder meridian. So you treat B54 right behind the knee, and that tremendously helps the sciatica, okay? And of course, you work with the low back also. So to me, it's like the best of both worlds. You're removing the interference in the low back, the pinched nerve in the low back, and you're also removing the blockage of the interference down the leg, which is the sciatic nerve.
So really, as I kind of try to wrap my arms around this concept, when you're looking at treating somebody for, say, sciatica, really this is your treatment protocol is let's look at all the potential causes for that problem versus isolating in on, say, one specific point and treating that symptom. Is that?
I would answer it this way and say it isn't just one cause, one cure. It's many causes, many cures. So if somebody has a pain, pins and needles, numbness, or burning, that's usually from a pinched nerve. It could be from a disc in your low back. It could be from a vertebrae. Like, for instance, your hips, your pelvis, your low back. That affects the kinetic chain. It's the domino effect in the knee. So yeah, you're having a problem with the knee, and you can work on the knee. You can adjust the knee. You can do acupuncture on the knee. But also, you can work on the kinetic chain that's higher up coming from the hips, the pelvis, low back. People don't realize this, that, it's cause and effect. So the hips, the pelvis, low back affect the knee. The knee is effect. You can get surgery on your knee, but maybe that's not where the problem's coming from. It could be coming from higher up. It could be coming from, a lot of times, your pelvis.
Well, that's one of the things as we, geared up to start doing this show and really talking to our people about chiropractic care, that there really is a unique approach because we're all so used to just going in, getting one specific thing treated, maybe having one doctor visit, coming out probably with a prescription or two, and then we go on. Okay? Then we continue to have these issues. And as we do these shows, I'm noticing that chiropractic care really is getting to the root of the problem versus the superficial. They were kind of peeling away that that onion per se, getting really down to the root cause and giving people true prolonged relief versus something that's short term and that they just keep, because a lot of people periodically throughout the year have like a cycle.
Right.
They have this problem. They'll get it feeling better for a little while by taking some type of medication probably. Goes away, comes back. It's just a vicious cycle that most people are locked into right now.
There's a difference between treating the symptom and actually correcting the cause of why you have the symptom. Mm-hmm. Like for instance, let's say you're walking around North Park later today. You had a pebble in your shoe. And you called your doctor and you said, we'll take a Tylenol. Now, if you called me, Jerry, what I would say is, Jerry, why don't you remove the pebble? Mm-hmm. So that's what we do. We remove the interference, remove the pebble. The pebble may be behind your knee, in front of your knee, in your shoulder, in your neck, in your low back. So we find out, the cause of why you have the symptom, and what we do is correct it. Mm-hmm. Make sense?
Oh, absolutely, absolutely. Now, one of the other things that I noticed as I was looking around getting ready for today's show is that not all chiropractors do. This isn't something that you can go to any chiropractor and they do.
It's a subspecialty within chiropractic.
Okay, so tell us a little bit about now. So you graduated from chiropractic school, then you had to go back for some specialized training.
Postgraduate training.
Okay, in regards to the non-invasive acupuncture.
Now, I went to graduated chiropractic school 28 years ago, so I don't know how it is back in 28 years ago. You didn't have acupuncture as part of the core curriculum. So after I got out of chiropractic school, I got postgraduate training in it. Mm-hmm. Okay, so the way it is now, I don't know. Maybe there is acupuncture training in chiropractic school. Mm-hmm. I hope there is.
Right.
Because there's a demand, there's a need for this, mm-hmm. and it's helping people.
Right. Well, as we try to help people on these shows with various problems that they have, really, I guess what we're trying to emphasize is if you're struggling with something, and maybe you're frustrated with the care that you've been getting, maybe you're looking for some alternatives, that Wellness Associates here really provides a wide range of treatment protocols for things. It's not a for lack of a better word, the cookie cutter approach where everybody that comes in with a knee problem gets the same treatment. It's really kind of getting down to the root cause, coming up with a specialized treatment program for that individual person, and then going into some maintenance and then some long-term things. This whole concept of the body with energy really is something that ought to get a lot of people thinking.
Body is 100% energy.
Right.
Did you ever hear that before, Jim?
I did, and I'll tell you, I think a lot of people do not understand how their overall health really impacts a lot of these problems. Mm-hmm. So, I know we're going to do some shows on even nutrition and some different things, and really our health in our life is a kind of a mixture of all this put together. And if you're weak in certain areas, it can come back and give you some long-term problems.
Just to sum up, we believe that health comes from within. Okay, so if you take a drug for something, that's not health, that's just suppressing the symptom. We now know that if you lose energy in the body, speaking of energy, that's the cause of the disease. That's what causes you to get old, okay? So how do you lose energy? 4 ways. How do you get it back? Your diet, your lifestyle, your nutrition, and your structure. Mm-hmm. So if you work on those 4 things, I'm a living testimony for that, because that's what I do, Jerry. Mm-hmm. I do work on my diet, my lifestyle, which means no smoking, drinking, taking drugs. Your nutrition, you need 90 nutrients every day, okay? So if you don't do these 3 things, your body's going to suffer. Then you're going to get the diagnosis, okay? So why not be proactive and do your diet, your lifestyle, your nutrition, and work on your structure? 9 times out of 10, you don't need drugs, you don't need medical doctors, you don't need hospitals. Mm-hmm. How do I know, Jerry? Because that's how I am.
Yeah. I'll tell you that the key word that you just brought up is this whole thing of being proactive. Yeah. I think too many times people are waiting until they actually have the problem, right? Versus doing some simple things on an everyday basis that can help avoid the problem.
Do you brush your teeth every day? Do you take a shower? Mm-hmm. Do you eat? Do you sleep? See, to me, ongoing attention, maintenance for the body, be responsible for your health. Be responsible for what you put into your body. And if you're not, make changes, positive rehabilitative changes in your life, mm-hmm. and you'll get results.
Yeah.
Okay, maybe we should change our name to the Results Chiropractic Clinic.
I know you've had some great results with, with the non-invasive acupuncture and a lot of the other treatment programs that we're talking about. So, we really encourage people that are watching this show today, pick up the phone, give your office a call, come down. You offer a great program for a new patient.
That's correct.
There's nothing better than a free evaluation for a new patient.
The reason we do that, Jerry, I'm going to interrupt you, but
Yeah.
we do it to see if you're a candidate for what we do. If you're a candidate for what we do, great, that means we'll be going to help you.
Yeah.
If we can't help you, we find somebody who can. That's the good news.
Yeah, it truly is a win-win for everybody involved. So, we encourage you, visit the website at AskDrGoldberg.com, pick up the phone, come down. The girls at the front desk are awesome. You're going to find this facility to be very, patient-friendly and kind of a great atmosphere to really take charge of your own health. So, we thank you for watching our show. Hopefully you've got some things out of what this non-invasive acupuncture can do for you. It might be something that can help a problem you're dealing with right now. So give the office a call. Let them, have you come down and show you what they can do to help. So thank you very much, Doc.
Thank you for having me.
Some great information, and we look forward to seeing everybody on the next show.